Hello, guys. Welcome back to Girl Flow Talks, your safe and honest space to learn about periods, women's health, and self-love. So you're feeling cramps, but your period hasn't started yet? It can feel confusing, even stressful, especially when you don't know what's going on. But don't worry. In this video, we're breaking down the most common reasons you might have cramps but no period, what your body's trying to tell you, and when it's time to talk to your doctor. So grab your tea, get comfy, and let's dive right in. Understanding period cramps. Let's start with what cramps actually are. Menstrual cramps happen when your uterus contracts to shed its lining. This process is controlled by hormones called prostaglandins. Sometimes those same contractions can happen even when no bleeding occurs. This means your body might be reacting as if your period is coming, but for one reason or another, it's delayed or skipped. It's totally normal to have mild cramps without bleeding once in a while. But when it happens often, that's when you should start paying attention. The 10 most common reasons. Let's go through the 10 possible causes of cramps with no period, one by one. Ovulation cramps. This is super common. About halfway through your cycle, you might feel mild pain on one side of your lower belly. That's your ovary releasing an egg. It can feel like period pain, but happens about 2 weeks earlier. Implantation cramps. If you've had unprotected sex recently, this could be an early sign of pregnancy. When a fertilized egg attaches to the uterus lining, it can cause light cramps and sometimes light spotting. Stress and anxiety. Emotional stress can actually delay ovulation, meaning your body feels like your period should come, but your hormones are holding it back. Cortisol, the stress hormone, can throw your whole cycle off balance. Birth control or medication changes. If you've started, stopped, or switched pills recently, your hormones are adjusting. That adjustment can cause cramps with no actual bleeding yet. Excess exercise or weight loss. When your body fat drops too low or you exercise intensely, your body can pause your menstrual cycle. It's your body's way of protecting itself. But cramps can still occur because hormones fluctuate. PCOS, polycystic ovary syndrome. Women with PCOS often experience missed periods, late periods, or cramps without bleeding because of irregular ovulation. Other signs may include acne, weight gain, or excess body hair. Thyroid imbalance. Your thyroid controls hormones that affect your entire cycle. When it's underactive or overactive, it can cause period irregularities and cramps. Perimenopause or puberty changes. If you're very young or nearing your 40s, your hormones might shift naturally, causing cramps even when no period appears. Endometriosis or fibroids. These are medical conditions where tissue, similar to the uterine lining, grows outside the uterus, or fibroids develop. They can cause severe cramps even when you don't have a period. Pregnancy or early miscarriage. Sometimes cramps happen in early pregnancy or if a very early miscarriage occurs. It's important to take a pregnancy test if your period is late and cramps continue. Now, let's talk about what you can do. Track your cycle. Use apps like Flow, Clue, or My Calendar to keep a record of symptoms. Stay hydrated and rest. Drink warm water, take a warm bath, or use a heating pad to relax your muscles. Manage your stress. Try light yoga, journaling, or even short walks to calm your mind. Eat balanced meals. Low iron, poor diet, or skipping meals can all affect your cycle. See a doctor if your cramps are very painful or frequent. You've missed more than 2 periods. You suspect pregnancy. You have other symptoms like dizziness or unusual discharge. Your doctor can run hormone tests or ultrasound to find the real cause. So guys, cramps without a period are actually pretty common, and most of the time, they're nothing to panic about. But your body is always communicating with you. Listen to it, take care of yourself, and never ignore what feels unusual. If you found this video helpful, make sure to like, subscribe, and share it with your friends. See you next time on Girl Flow Talks, where we talk all things women's health, self-love, and body confidence.